Thank you, Dr. Song, who is a dear friend, an exceptional physician, and also, I'm proud to say, my constituent. So thank you to everyone for being here today. I'm State Senator Kristin Phillips-Hill. I have the pleasure of representing the 28th District in the Senate of Pennsylvania. Senate Bill 225 and House Bill 225 will streamline and standardize the process for prior authorization of medical services here in Pennsylvania. All too often, the prior authorization process is inefficient and it increases costs for providers and their patients. Not only that, but the administrative hurdles that providers must constantly go through on a daily basis, it impedes the quality of care that they can give to each and every one of their patients. The practice of medicine is drastically different than it was even 10 years ago. There are far more regulatory barriers and administrative obstacles that make it much more challenging for all of these physicians you see here today to do their jobs. Every day, their job as a provider is to care for the people of Pennsylvania. And we would not be doing our job as legislators if we did not recognize and try to remove some of those burdens, allowing physicians to take care of patients, not paperwork. You are caring for our families, for our friends, and for our constituents. Quality and timely care is what each one of us, we expect it and we deserve it. But that care can be difficult without a standardized process or definition for prior authorization of procedures across the board for every specialty and every insurance provider. This legislation will also significantly streamline the process by requiring insurers to make electronic communication available so that requests, authorizations, and adverse determinations can all be submitted or returned electronically. Excessive healthcare insurer prior authorization requirements can lead to a delay or denial of medically necessary care. You heard Dr. Leonard talk about it. And patients should never be forced to worry about whether the procedure that they needed to have is going to be paid for or not. The simple truth is that if an insurance company says yes to a treatment, then it should be paid for. These bills ensure that patients can rely on those decisions. And I want to make something very clear. These bills do not eliminate or abolish the prior authorization process. Rather, this legislation returns the meaning of prior authorization back to what it was intended to be, a way to cut back on unnecessary or highly risky procedures and protect against potential fraud. It will increase efficiency, reduce costs, and maximize quality and timely care for patients. And they make common sense improvements to an already important and existing piece of legislation. Again, thank you to all of our hardworking medical professionals who joined us today, and thank you for your advocacy to ensure that your fellow healthcare providers can provide the best possible care for all of their patients. Thank you.